Good evening, everyone, and welcome to DCSD Parent University. My name is Stacy. I work for the DCSD Communications Department, and alongside our partner, Skyridge Medical Center, this program aims to provide monthly engaging, relevant, and helpful content to DCSD parents. I'm so glad you can join us tonight, and I'm so glad to be introducing our two guests. The first is Pediatric Sports Medicine physician, Dr. Brooke Pengel. Dr. Pengel is with the Rocky Mountain Pediatric Ortho 1 at Skyridge Medical Center. With us, we also have Derek Chaney, the Activities and Athletics Director for the Douglas County School District. Dr. Pengel will present for 30 minutes, and then we will have 15 minutes for a live Q&A with both of our guests at the end. So Dr. Pengel, I'll hand it off to you from here.
Great, thanks, Stacy. So you can see my screen okay? Yes? Can you hear me okay?
Yep, looks like you're ready to go.
Perfect. So thanks for joining. I wanted to just give you a little background on what I do and why I'm here speaking with you tonight. I definitely have a passion for education of parents and athletes. As Stacy said, I'm a pediatric sports medicine doctor. I've been practicing for about 20 years. I practice here at Skyridge, right in the heart of your district. And I have, over the years, I love taking care of my patients. It's definitely gives me a lot of joy, but I also find a lot of joy in providing education to community. I've held service positions that have to do with education. I served nationally on a committee for the American Academy of Pediatrics for Sports Medicine. I'll be speaking and referencing some of the things from my committee there when I was on the committee. And I'm also currently serving on the CHASA Sports Medicine Advisory Board. I'm a team physician in this community, and I love sharing, again, my passion and my expertise. And so hopefully I will provide you some words of wisdom. I'm happy to take some questions afterwards. I'm focusing a lot of my talk tonight on just pearls I'm a sports parent, that's another disclosure. I have 3 of my own children. They're all teenagers, all in high school, first day of high school for them today, all together. And I'm in it with you. There is some landscape to navigate there with kids in sports. And so I'm hoping that you'll enjoy kind of our discussion tonight. So my objective tonight will be to talk about this youth landscape and, how did we get where we are? I'm going to be talking about the participation of youth in sports and how there has been a trend towards sports specialization. I will focus mainly on injury prevention. There's lots of injuries I could talk about, but I'm going to be giving a kind of an overview on general concepts of prevention. And I'm going to spend a little time on how parents and coaches can help the youth sports landscape and where can we be going in that regard. I have emailed to Stacy a resource list, so the links that I'll be referencing shall be in that list. So one of the things I like to start with is that I've kind of learned, even with treating a lot of athletes through the years, is that I have sort of spun even my own kind of concept of, what is success in youth sports? And I try to pass this along to certainly my own children and my patients, that I really think the end game for sports should be a lifelong love of sports. And that really translates into as an adult, because kids are not going to be playing the same sports, and when they become an adult, but a physically active lifestyle, because it's so important for our health. And so I have this mantra that sports are, we do them because they're fun. And I want all kids to be included and be very inclusive. It doesn't have to always be a competitive thing, and sports for life. So that's kind of my mantra. And that's, if we can get kids enjoying sports at young ages and coming up through high school, maybe into college, if the end game is that they have a really good flavor of that, they have a desire to keep doing active things, that's, to me, is the win. No matter what the scores were and what the outcomes were, if they are active as an adult, that is how I define success in youth sports. So let's talk a little bit about the stats. There are approximately 45 million kids participating in organized sports. Unfortunately, when we look at the stats of what happens through that age group, unfortunately, about By 13 years old, about 70% of those same kids have quit. And by 15, about 80% of them quit. And I find it very unfortunate. A lot of it is that kids are kind of going, either they're going on the competitive track, and if there isn't a recreational track, they drop. And so that's, I don't think, a great stat. And I'll talk a little bit about why I think that is occurring and why experts think that is occurring. And the reality of the situation is, on this drive for success that, again, most people define as maybe a scholarship, that's a very unrealistic thing for most athletes. Less than 1% of high school athletes will earn a scholarship. And if you go even in playing in college, a lot of them don't even play scholarship or not. And then, of course, going on to the pros is a super rare situation. Not discouraging people if they have that dream, but again, we have to define, is that our success if they get to play in college, or are there other things that are also can define success along the way? I think this is something we can all agree on, that the benefits of youth sports, if you look at this list, it's a very profound list, that athletes compared to non-athletes have all of these benefits that have been proven in multiple studies in terms of their social well-being, certainly their physical health and psychological health, their academic performance, and then it crosses over into other health behaviors in terms of getting into trouble, basically, is what I say. And so these are things that are very, very helpful for athletes. And I think we all can agree as parents that it is something that can help them have other behaviors crossing over into other parts of their life and very adaptive. So I wanted to start with a little bit on sports specialization and define that. What that means is really an intensive focus, and it's year-round training in one single sport. And really, as the kicker is, it's at the exclusion of other sports. This is different than early entry into sports. So you can have, say, this little golfer on the right, you can get him playing golf at a very young age. But if by the age of 6 or 7 or 8 or 9, that athlete is only playing golf, they are playing golf year round, they will not play other sports. They don't have time to play other sports. That's that specialized kid. And that's the trend that I'm seeing as a pediatric sports medicine physician. The patients that come to see me, if they're a soccer player, they're a 9-year-old traveling soccer player, and they oftentimes don't play other sports. So that's what I'm seeing. So let's talk about, well, what is that? Is that good for kids? And so I have this sort of pro-con list. So it does help in certain sports if, again, you're trying to get them to succeed in that sport competitively, and that's strongest in sports that have kind of a peak in the adolescent, kind of early years. Those sports are listed there, like the gymnasts, the divers, and obviously they have typically the best path to early success because of their coaching. And it really, they thrive on that because they have more self-esteem, or if they're playing up and they're this young child who is very talented, and they typically have access to sort of the more sophisticated and really competitive coaches in the competition. If we flip it and say, well, could that be harmful, or could that be a problem for a child? Well, the studies are showing that those kids that are very focused on the one sport may have a little bit of socialization issues. And ironically, it actually can hinder their athletic development as a whole, because they're doing a same repetitive motion sport, and it's limiting their kind of the variety of motions that they would be training if they were in other sports. And with this high volume, what I'll be speaking of, it's very much at risk for overuse. And the research is showing that these athletes are actually at risk for burnout, and it's actually shortening their career. So what's the alternative? What's the multi-sport athlete? Someone who is playing multiple sports, different sports seasons, and we're seeing that those athletes have longer player careers, they have better peer relationships, and ironically, they really are sometimes in that talent pool of the higher level athletes. But this is something that, again, the trend is against that, and it's harder these days to actually be a multi-sport athlete given the demands of the single sport. So what is the verdict? Well, the verdict kind of got me probably hinting at this, is that early sports specialization has actually been linked to a significant increase in overuse injuries and burnout. This is actually a study around 2015. So the two front authors of this study are two of my colleagues who were on my committee that I rotated off of recently, and they have been the leaders in the research on sports specialization. So from this study, and it's kind of a goofy stat that how would this make sense, but it's panned out and now in multiple studies that if you look at the age and years, so if you have a 12-year-old who's participating more than 12 hours per week in that single sport, then that significantly increases the risk of injury. So it's not that that has to be followed, but it's a little bit of a rule of thumb as you're raising the kids and how many hours a week they're doing, that can actually increase their risk. It's been seen to be a risk factor. As opposed to this diversified sports training during the early years, actually is more effective at developing elite level skills. So it's not only showing that there's a problem from an injury standpoint, but it's showing that if you flip it to the multi-sport athlete, that actually can give them the greater success, and there's a skills transfer there. So again, this downside of organized sport, we'll be talking about injury, but this is the kind of list of things of what can happen. I mean, if you're a parent with sports, it's like, when do you even eat dinner together? That's kind of, I love eating dinner with my family, and sometimes the sports don't allow us to do it. And there's just a lot of pressure cooker, and there's kind of that risk of overtraining. So the youth sports injury, I'm going to talk a little bit about that and then flip to prevention. So high school athletes account for more than 2 million injuries, and a lot of these are doctor's visits. Some of them more severe injuries are hospitalizations. And why are they on the rise? Well, we have this trend towards a significant amount of competition and participation throughout the year. And these are not adult bones. These are immature bones. They have immature structure, and they perhaps their bodies aren't really made for that at that age. And so that's what I end up seeing. And a lot of them are having so much competition and so much exercise that there's not enough rest, whether it be throughout the year or after an injury. And sometimes there's a conditioning issue. So one of our mantras in pediatrics is kids are not mini adults. And I usually say, and they're certainly not mini professional athletes, although we treat their schedules as such. So that's kind of what's going on. In terms of the unique injuries that kids can get, so on the bottom right here is a picture of a growth plates in the knee. So they're the developing tissues at the end of the long bones. As the child grows, the growth plate tissue, the cartilage, is replaced by solid bone, and then the growth plates fuse. And there are very specific patterns of injury that I see to the growing bone structure that can occur. And certain injuries to these growth plates, some of them are recoverable, but some of them can have a more problematic prognosis. So that's why people like me exist, to figure out kind of what is growth plate involved or not, and what can we do to manage that. In terms of the types of injuries that I see, so we sort of divide them into a chronic kind of overuse type injury or an acute injury. A lot of the acute injuries are not preventable. It's accidents that happen on the sport field. But some of them are, we'll talk about. And then the overuse injuries, in my opinion, a lot of these are preventable if the training were adapted to be a little bit more appropriate for the child. And 50%, that kind of stat there is 50, it's kind of 50% from overuse in youth, and 50% are acute injuries. So overuse injury occurs when there's this sort of constant level of stress to the tissues and inadequate recovery time, this mismatch. And that's sort of the definition of most kids in their sports schedule these days. The features that you would recognize, or they might be subtle, would be pain. Of course, that usually is what brings them to my office, but sometimes it can be a deficit in motion. Sometimes it can be a fatigue level that they can't get past, or it can be affecting their performance. So the key is really to get to these injuries early because they are easier to manage. And I'm going to be going into some risk factors, but the main risk factor is this high training volume that I discussed with the kind of hours greater than years in age. But sometimes there's just a significant rapid increase in this overscheduling concept. They're having a prior injury is a strong predictor of having an overuse injury. And then the growth spurt. So I'm going to be getting into those a little bit. This is an article that I wrote that details common overuse injuries, sort of medical spin article, but I have a chart from that article that I think is very relevant for this talk. And I'm actually going to break down each of these boxes because this is really wanted to get if there's any pearls of anything you can do, because I could talk about all these injuries, but there are some things, these are preventable. Some of them are preventable. And so let's go through each of these. So if you look and figure out in the athlete, if they have this risk factor, there are some things that can do. So for example, prior injury I mentioned. So this is an ankle sprain in this ankle here. So if the child has an acute injury, was it properly diagnosed? Did they seek care? And what was the treatment? And what was the rehabilitation of the area? And ankle, I think, is actually an excellent example because I know too many people who just blow right past the ankle sprain and they don't take the time to treat it. They don't take the time to rehabilitate the ankle and a return to play progression. You know, that's something that's very important to make sure the ankle is ready for all of that workload. And if that doesn't happen, then what I see is chronic pain in the ankle or recurrent instability, which can be a little harder to treat later. So that I think is a really good example of addressing that injury in the appropriate fashion. For overuse injury, really, we want to kind of look at like, what's the training volume versus the rest time? Is there a mismatch? Can we work on that there? And if it's amendable to a physical therapy plan that can correct some of these imbalances that might be contributing to it. So that's what, if there is that in the history, then those are the things that you can do is to get the right kind of appropriate care for that. As far as a growth spurt, there are specific times in adolescent where kids are a little more susceptible to certain injuries. So if there is an awareness of that, for example, like in a gymnast, when female gymnasts are around 11 or 12, their growth plate in their wrist is growing very intensely. And so they're at risk for a stress fracture in the growth plate. So if there's an awareness there and we can get to it early, it's easier to treat. And then during these growth spurts, a lot of times I've got a bunch of gymnasts right now that I'm managing that I'm having to dampen their workload a little bit so that they can get through this period of growth spurt without significant injury. Medical supervision, I think, is a huge one. So you may or may not be familiar with these forms. So these are the CHASA here in Colorado, the endorsed forms for a pre-participation physical examination, which is a CHASA requirement yearly. And so these are the forms, and I don't need to blow them up too big, but they're very specific questions. And these actually ones are adapted to have COVID-19 questions because there is some heart health questions related to that. So the parent and the family will fill out all these questions and then bring it to the physician, who will ultimately sign off or not sign off on their clearance. I kind of blew this one up big because I want to make a very important point here that these, again, are the endorsed forms that we want everyone to go back with each of the member schools. And what it says, it's kind of a yes or no question. Are they cleared or are they not cleared? But what I always like to emphasize is that if your child or your student athlete has a specific issue, please have the physician be very specific in this, what's called this shared emergency information. Because if your child has asthma, then the schools are not getting the medical record. There are some things going on with the kind of HIPAA and something called FERPA that they're getting this final clearance form. So if there is relevant medical illness or something that you need the coach to know, you need the athletic trainer to know, it's very important to include this so that they can take proper care of your child. I cannot emphasize that enough. That's the best and the safest thing that you can do for your student athlete, is to share that information. So it's sort of on you as parents to offer to the school, this is the needs of my child. If they have an asthma care plan, a diabetes care plan, or whatever it might be, this is the time to declare it. This is the time for the pediatrician or the family doctor to put it in there so everyone knows what to do in signs of emergency. So that's kind of pretty passionate about that, because I feel like anywhere, and especially I'm on the CHASA Sports Medicine Advisory Board, and we go round and round about, we wanted this form to be standard, but we really want people to use it appropriately. So as far as the training load, this is where sometimes parents kind of laugh at me a little bit. They're like, what do you mean all this rest? But we usually, as experts, say 1 to 2 days per week of rest from their primary sport and 2 to 3 months per year hopefully in 1 month increments. And that's where people are like, what are you talking about? There's no time. And given a sport, there's certain sports where that just is not the schedule, but it doesn't mean I'm going to change my answer. If you want to prevent injury, that's what really the body needs, or the young body needs. Participating on multiple teams concurrently is a known risk factor. So if that can be minimized, and then the training load, if that can be gradually increased over time, that's protective of injury, and not playing through pain is key. We already touched on the sports specialization. So if possible, encouraging all these variety of sports until perhaps late adolescence. That's what most of us think, because it's healthier to get them playing a lot of things. But at some point, it's not that you can't specialize, but the more that you can delay it, the better, in terms of those overuse risk factors. And then when they do choose to specialize, monitoring them specifically for signs of injury. And then these athletes are go, go, go. So what are their nutritional needs? And really a big one and a hot topic, and it's really been pretty brutal through COVID with the emotional and kind of the mental health needs of kids. And athletes really took a big hit there for sure, because the sports were closed for so long. So monitoring those athletes through that. As far as injury prevention, when it comes to equipment and coaching, of course, proper condition and fit of the equipment is key. So really leaning on knowledgeable coaches, and, sometimes even the sports manufacturers, and can help a lot with that. And coach education is a big one. And I know there's you guys run a really tight ship in this district, and I respect all of your athletic trainers. I know most of them personally, and I think they do a great job at kind of pulling in and helping with education across the sports medicine program. If you are so inclined, or if you're a youth coach, that maybe may or may not have these requirements, but I wanted to point out that the National Federation of State High School Association, NFHS, has abundance of resources for you if you want to go out of your way to be educated about heat illness and there are multiple courses that can be taken. Most of them are free, and it's really an excellent resource. So please use it if you need to. As far as preseason conditioning, there are some specific recommendations about acclimatizing to the heat, especially with our football players who have a lot of equipment. So that's very important, and there are certainly bylaws and CHASA bylaws that require this. And then proper training programs are very important with strength and flexibility and neuromuscular control. And there's a lot of research ongoing and in the past about how those are effective at preventing injury and having enough time in the preseason. I know it was a big problem when the kids were really shut down for COVID, and then they came back fast and furious, and it was like crazy, the stuff that was coming into my office, that it was like these condensed seasons, and it was really intense because there wasn't a lot of preseason. So where are we going? So that was a big, huge primer on youth sports prevention. Hopefully you got some pearls from that. What I wanted to move forward, just because I want to keep on time here, is that I just wanted to do a little bit about sports parenting. I find that there is definitely some deterioration, I think, in our youth sports culture. And we have got kids that are kind of caught in the middle, that there's like pressure to succeed. And without the kind of, we need as parents, I think, to kind of help take control and kind of bring it back and give the sports back to the kid at a fun level. So what can we do? Setting realistic goals for each of our kids, and decreasing pressure when we can. And I always like to focus on, are you your best you, or are you comparing you to someone else that might have different talent and different inherent skills and gifts? And so emphasizing development over winning, and focusing on kind of what are the character building that you're getting through sports and the life lessons, and being willing to reroute, being willing to pull and rest or change a sport or that type of thing, honoring the athlete's choices and seeking help when you need to. And parents can be the best of advocates. I'm not here to insult anyone, but we all know that we are human and we can get into it with our kids' sports. So we all know that classic over-involved parent who really is very loud and really sometimes even disruptive, and just the emotions are really driving that behavior and the obsession with winning, as opposed to a parent being an advocate emphasizing that they are student athletes and using those really positive values, who's someone who's very grounded and very encouraging, and wants their child to win, but does it in an encouraging and a very composed way, is supportive of mistakes and failures and doesn't waste them, but uses them to keep moving forward. So that's really parents as advocates. And this is a few things that I think are, if you can incorporate this at a very young age. This was, to me, this slide like changed my life when it came to my youth sports parenting. So I was kind of reading through some things, and there is a lot of kind of movements up out there about trying to take, sports parenting very seriously. And so some of the things that just words to use with your kids before a competition. And if you discipline yourself to say these things and not to say some of the scrutinizing things. So before a competition, hey, son, or hey, like, have fun, play hard, I love you. And after competition, did you have fun? That should be the first question, not like, why'd you miss that goal or something like that? I'm proud of you and I love you. But the real kicker, and what I started doing years ago when my kids were little, because I watched a TED Talk, in case you're curious, there's a TED Talk on this, that this is the 6 words that the parents need to say to their kids about sports. Just these 6 words will change your kids' sports trajectory. And the 6 words, I love to watch you play, because that's all they want. They just want your attention. The little kids on the swing, like, mommy, watch me, watch me, watch me. They still want it. They want to know that you're there. And when that's the lens that you give them, I just love to watch you play. If you lose, if you win, I just love watching you play. I'm here with you. I'm in it with you. That is something that's very powerful. There is a TED Talk that kind of goes into it a little bit more. And it really is kind of life-changing. So that's you being an advocate, that you're not micromanaging the this or the that of terms of their performance, but you're just simply enjoying it with them, and they will respond. This is one of my favorite parent advocate signs. So your child's success or lack of success in sports does not indicate what kind of parent you are. But having an athlete is coachable, respectful, a great teammate, mentally tough, resilient, and tries their best is a direct reflection of your parenting. So that's the teammate that I want in my children, that I know their inherent talent is what it is, but they can be a good teammate if they are encouraged. So I'm going to go rapid fire now, because I've been talking kind of fast still. So my links and my resources are all in the handout. I was happy to hear, because I spoke with Jeff Dale, who is one of the VPs of Positive Coaching Alliance. And it sounds like there's some kind of schools in Douglas County that are embarking on a relationship here. And I could not be happier, because I am really quite aligned with this organization, with the passion that I feel about us being better coaches, better parents, that type of thing. Their mantra is better athletes, better people. This is their website. And down here, they even highlighted Ted Lasso, and the word that is in this, it says the relentlessly positive coach. And that's what I like to be as a parent. I like to be a relentlessly positive parent. Just going to get a drink of water here, because that's what we have control over. There's a lot of things we don't have control over. So this is one of my favorite things from PCA. If anyone's heard about the filling the emotional tank, this is just like a gas tank. Like if you have a kid who is really low on their emotional tank and you fill it up with that positive parenting, it enables them to do everything better. They can learn, they can perform, and they can be happier. So that's like a concept that I learned through them. Their development zone is very, very deep and rich with resources. So please visit it. You can search all sorts of topics or kind of scroll through what they have there. Project Play also has, I'm aligned with them with the Sports for All, Sports for Life. They have a lot of resources that you can link to from my handout list of just talking about how we can get kids exercising at a young age and then staying physically literate is the word in the term, so that they're active as adults. These are medical resources. There is a CHASA Sports Medicine handbook that has some kind of medical things and some alerts that go out, particularly to coaches, but that's something that you as a parent could look at as well. And then this is the committee I was on, the AAP. AMSSM is also, these are all resources, and specifically to this talk, there were some position statements about overtraining and youth sports prevention. The AAP's parent website is Healthy Children, where you can get some of these handouts. And this is out of my committee. These are some of the position statements that actually, when I was on the committee, my committee published these. So it has things like, for our resistance training position statement, things like including a dynamic warm-up in training sessions, using proper technique supervised by a qualified professional. So these are all medical resources, but in the kind of conclusions of these statements, there are very practical things that you can look at. And so you can kind of look through this list. There's one on soccer, and then this one is on football about the kind of tackling age and that type of thing. There's one on ice hockey about changing the age that they were doing checking and contact. This one on ACL prevention, highlighting that neuromuscular training I was alluding to. So these are all very solid evidence-based research articles that you can get some good prevention tools. And then this one is Stop Sports Injury, as a campaign that also has some good resources. So in conclusion, I hope I kind of offer to you that sport diversification and multi-sport athlete is proving to be superior. So hopefully you can continue to try to strive for that. It's not always easy in this landscape. Anything you can do to prevent, we talked about that. Injuries are not always avoidable, but if you can identify those risk factors we talked about and intervene early. And then there are many resources to be that relentlessly positive parent, and focusing really on that fun, on that fitness for life, character building. And then I say the outcome takes care of itself if that's what you do. This is my team at Skyridge. We have our 3 orthopedic surgeons and then our 2 sports medicine surgeons, Dr. Brewer and I, and we are always happy to be a resource here at Skyridge Medical Center. So, and we have walk-in availability here at Skyridge for athletes, 8:30 to 11:30 all week long. And that's just a good resource, kind of an access point for when there's sports injuries and need to be addressed timely. So that's all I have. Thank you so much for your attention.
Thank you, Dr. Pengel, for a great presentation and some amazing resources. And everyone attending and who registered will receive a copy of this presentation, as well as all the resources Dr. Pengel had referenced. Derek Chaney, is there anything you would like to add on before we head to the Q&A?
No, I think just to echo what Dr. Pengel said, it's amazing how it's aligned. We honestly did not even see the presentation until now, but we do have a partnership with Positive Coaching Alliance. Really excited about that, and we've worked with them for a long time, and so definitely working on that with our coaches. And it's funny, we share the same thing. If you read our handbook, my biggest mantra to the kids are to have fun, be a good teammate, and play with passion. Mm-hmm. You know, it's funny how those align, and that's so it's good. So no, I thought it was a great presentation, very well done, very aligned with what we're trying to do here in Douglas County. So thank you, Dr. Pengel. I thought it was really good.
Yeah, thanks.
Great. So if you have a question for either of our guests, please use the Q&A feature through Zoom, and we can help you out there and get you some answers. In the meantime, we do have one question. How can you inspire kids to want to get involved in sports?
So I think that's a great question. And I really want everyone to remember that we really, whether it be sports or physical activity, I sort of meld them together. In fact, the other day I was talking to my daughter and I said, I consider that 5-year-old on the monkey bar as an athlete. So how I would say getting kids inspired is that we actually need to teach them movement skills through fun activities that they can do as a young age, because there is this concept of physical literacy that just like, you know, reading and writing, there is actually a certain age you have got to get them reading by so that they will be literate. And the same concept is that we need to get them out there on things, you know, like jumping around in playgrounds and that type of thing, so that they develop the desire and the confidence to be physically active. So it can start really little. So think small, get them active, get them enjoying running around and being active, so that when they are eligible or want to do something a little bit more, maybe in an organized fashion, they know how to move. They have been moving, they have been playing, they've been physically active. And we as parents really need to model that for our children, because we can't tell them to be active if we're not active. So being active as a family is how you can inspire them. And then introducing them to a lot of different things. That's what I say. That's how you inspire them, because one kid is going to be inspired by baseball and the next kid's going to be like, no way, I want football. So I think just exposing them to a lot of different things is how you inspire them, because they'll catch on to what they like.
Awesome. Would you like to add anything else, Mr.
Yeah,
Chaney?
the only thing I would add, just from my own personal experience, is, what's more important than their kids and their peers, right? And so I had, one of my kids wouldn't play a sport, and I said, why don't we get a bunch of your friends to play, and then they could have fun with their friends and do that. And so that really, to kind of motivate them, inspire them, like, oh yeah, I can do it with my friends, because that, they may not want to do something, but boy, if their friends want to do it, all of a sudden they'll have an interest in doing it. So I think trying to, especially in the youth, to get, just to get teammates they know and familiar with, and they're having fun together. And I think that's a good way, just to add to everything that Dr. Pengel said as well.
Yeah, I mean, I love that. And it really does teach them different ways to interact with them, and, whether it be competition or not, but there's just so many life lessons. So that is a really good carrot to hold, like get them together for sure, because it's what it's all about. It's about like your friends and your snacks in the youth sports.
All right, we've got another question here. When my child is struggling in sports, what's the best way for me as a parent to help them learn from it?
Oh, that's a great question. Derek, I'm sure you have lots of wise words, but I would say that I always like to be honest, like flip the narrative. It can be difficult depending on what that challenge is, because that question is a little bit vague, but there could be 10 different things I could think of, which would be the challenge in the sport, whether it be cut from the team, not playing well, benched, it could be injury, it could be a lot of things. But I always like to flip the narrative and say, okay, well, you are going to become stronger through this challenge. How can we, let's try to think of a couple things that you could finish this sentence. This challenge is going to be good because blank, because I'm going to learn how to, learn a lot of perseverance or that type of thing. Or I'm going to, if I'm benched on my team, it's actually going to it's going to inspire me to work harder, and I'm going to show that grit and that type of thing. So I tried to flip the narrative and say, well, what's the opportunity? Here's the disappointment, the failure, that type of thing. Don't waste the failures. I always tell that to parents. It sounds so creepy for me to say this, but I have this secret desire for my kids to have failures here and there, because guess what? If they don't, they are not going to be strong as adults. I don't obviously want them to fail. That sounds so crazy, but they need to have those moments in life. And so that's what I would say. How do we encourage them? We try to help them think outside of it and say, well, what do I have control of? And how can I ultimately think of this as a good thing, even though in the moment it feels really crummy?
Yeah, I think great answer. I would echo everything she said, and just maybe add a few things to it. And again, it's specific to the situation. It's hard to answer the general one, but I think that there is tons of value in learning from the adversity and the failure. And I think that's a key piece. And, a lot of times, and I'll use PCA here, right? They talk about different things they talk about flushing, having a short-term memory, right? Like flush it away and have a short-term memory, and not let one thing just keep snowballing on and on. And it's always what I've helped too is kids and start pressing. If they're not doing well, they start pressing harder and doing more. It's like, back up. Are you having fun? Have fun. Just because if they can relax a little bit, sometimes they keep pressing. It's too much. And so just to back up and have fun with it. So it's specific to the situation. So those are just maybe some general things to add to what Dr. Pengel said.
Yeah. And I love the PCA mantra where if we have an environment for our children, whether it be in the sports arena or at home, where mistakes are okay. Mistakes are okay. And if it's not like that, they're not going to have this sort of mindset that they can get beyond it. So it's really that, like you said, whether it be flushing it away but there are tools that are taught through PCA. So I'm super excited that relationship will be expanded. I'm on the leadership council. And so I kind of heard about that. And then I asked Jeff about it. So can't talk enough about that. That's how if you even attend a workshop through PCA, you will help your children through those, those moments, because that's the tools that they're giving you all packaged in the PCA kind of workshops and that type of thing.
Wonderful, thank you. Last question. How can parents inspire other adults to embrace the relentless positive coaching and parenting practices?
Yeah, that is always a tough one in the moment, because I think we've all, as a sports parent, when you are in that, situation where it's really going downhill, like on a sideline or something like that, it's really hard to know kind of, what's the boundary there? Like how do you, whether it be that or just a team kind of, the kids' word, the vibe of the team. If it's really negative, how do you really change that? And I think that it can be hard to know, but I usually say, first of all, you have to model it. You have to be that relentless parent. And what I try to do is go out of my way of passing on things that have inspired me. So I have, my feed to my emails. I get the newsletters from PCA. I have this, there's a website called Changing the Game, a project, and it's awesome. It has like blogs and that type of thing. And so I try to pass those things on to maybe people who are struggling, and just kind of fill my kind of feed with like things that I can either share with someone or share with my child. So if someone is really stuck in that really negative kind of way and that negative mindset, I mean, you can only do so much, right? You can model it, you can offer alternatives, you can try to bring the mood up, you can, insert yourself with, kindly and not in a negative way to pull them down, but try to offer an alternative. But again, that's a little bit of a kind of a general question too, but we've all been in situations where we have a very uncomfortable situation with the parent that's just not on the same page. And so all you can do is model it and try to offer an alternative. What do you think, Derek? I'm sure you have some good answers there.
No, that's good. That's a difficult scenario. Adults holding adults accountable. I mean, I agree with you. Don't partake in it. Don't, keep it going, and just, definitely, the big thing is don't partake in, I don't know if you remember this with PCA, and it's kind of a weird example. They had a parent meeting at the beginning of the year, and then they were holding each other accountable, and they bought little lollipops, and like they would give them out to parents who got all fired up during the game. And so it's kind of a hint like, hey, do you need a lollipop, right? And then they were like, kind of shut up, put it in their mouth and shut up, basically is what it was saying. But there was this idea, I think that was in a PCA book I read, but just trying to like kind of, and have them get on the same page. I think getting on the same page before the season's important, because emotions are not high at that point. Emotions get higher as you get throughout the season and going. So, most, even youth programs, there's usually a parent meeting, but having parents dialogue and communicate that, and how can they, we're all here for the kids. Let's not embarrass our kids. How can we help support each other? We're all going to get fired up. We're parents, and it's hard not to at times, but just how do you give just a subtle reminder, like, hey, here's a sucker, a lollipop or something like that. But it's hard. That's a challenge, because adults do not want to be told how to parent their kid and how to act at that places. So difficult question, but I think, those are a few suggestions.
Yeah, they have a campaign too through Positive Coaching Alliance. There's these commercials that you remember seeing. It's called Dare to Chill, where they had this example of where they were going around to the sidelines and like making the parents do yoga and do breathing and all this stuff, like poking fun at the fact that like we literally can't calm ourselves down. So I think the lollipop is cool too. But I guess I would just add one more thing to that, Derek, that I think it does come from the top down. So if you have a culture in the district, in the sports, in the school, in the coaching, like it really, that can set the tone of what the tolerance level of that behavior is. And so that's why I think, your district does a great job. You're still going to have those parents. So, but sometimes another idea would be to try for that parent to partner with the coach or partner with the sports organization to say, this has been a problem recently. Can you help? Given that it's, you're the leaders of this organization, to try to address it. And that can help a little bit too.
All right. Well, thank you very much, Dr. Pengel and Mr. Chaney, for joining us. It looks like we've reached the end of our time together. Before we depart, everyone here will receive a recording of this webinar, or at least a link to it on our DCSD YouTube page, as well as the presentation slides and resources that Dr. Pengel mentioned. And we'd also love to get your feedback on your experience. And as a thank you option for filling out this survey, you have the option to receive a gift directly from Skyridge Medical Center. It's a mini first aid kit. Just complete the form at that bit.ly DCSD ready for sports, or scan the QR code. Just complete that form, leave your mailing address, and Skyridge will ship it to you. No contact, super easy, and with plenty of thanks. And just want to let you know that the next Parent University webinar will be next Wednesday, August 25th. It will be a couple of our people from DCSD talking about social emotional well-being and how you can start the school year off strong with your kids. You can find more information on that at dcsdk12.org/Parent University. Once again, thank you for joining us. I hope you have a wonderful evening, and we look forward to seeing you next time.